Our patient today is a 50-year-old male who arrives to his primary care clinic for an annual checkup and appears malnourished, has yellowing of the eyes or jaundice, is lethargic, and having complaints of a dry, burning mouth. He has a history of chronic alcoholism, in which he remained sober for a couple years but has recently relapsed. He has difficulty forming bowel movements and admits to not having a well-balanced diet since his relapse began. He also has hepatitis, and his most recent lab work shows a folate of 3.0, RBCs 3.7, MCV 78, MCH is 22, hemoglobin 10, and hematocrit 40%. These symptoms, values, patient history all seem to indicate that he has folate deficiency anemia, most likely brought on by his chronic alcohol abuse and recent diagnosis of hepatitis, as well as his poor diet that he admits to. Hello, sir. I'd like to speak with you briefly on your most recent blood work results as well as the symptoms that you came in with today. So those things, along with your past medical history, seem to indicate that you're just experiencing folate deficiency anemia. So anemia is when your body doesn't have enough healthy red blood cells in its circulation, and those red blood cells are important for transporting oxygen to other parts of your body, other organs. And folate is essential to the production of these red blood cells. It actually plays a key part in the synthesis of DNA. And the thing about folate is it's completely absorbed through your diet. So it's not something that your body makes. You actually have to take it in through your diet. So whatever you eat is how you get folate. Now, after you digest this folate, it circulates through your body back through your liver, where it's stored and then later metabolized, which can be an issue if you experience alcohol abuse or liver damage. Those things are going to impact how well you store and metabolize that folate. So it's not only an issue with diet in this case or in your case, it could also be an issue from your alcohol abuse and the part that it plays on your liver function. In addition, however, you're also at risk for B12 deficiency anemia, which is just another vitamin, iron deficiency anemia, and if you're on any antivirals for your hepatitis, those can also promote anemia. Now, there are a couple things we can do to treat your anemia. With folate deficiency or B12 deficiency, all you have to do is supplement those things or identify the cause of the imbalance. So in your case, there are two things that play a part. There is your liver damage from your alcohol use, as well as a poor diet, which you admitted to. So what we can do is we can provide supplements, folate supplements, as well as, you can start taking in things that are rich in folate, which include green leafy vegetables, citrus fruits like oranges, lemons, and other types of grains and nuts. Those things are all going to improve the amount of folate in your system and hopefully start to counteract that anemia you've been experiencing. In addition to folate supplementation, what you really need to do is try and stop drinking alcohol. Now, I know this is very difficult. I'm going to provide you some resources, some help, so we can do this together. But really stopping your drinking is really going to benefit you in a lot of ways. It's going to stop damaging your liver. It's going to help promote your folate metabolism. and it's also going to limit the effects of your hepatitis. So this is really important that we try and get a grip on this together. You're not alone in this, but I am going to provide you some more education, some resources to hopefully help you through this tough time that you're in right now.